My name is Kathleen LeMaitre, and I'm an obstetrician gynecologist. My father was a surgeon, so when I was about 12 years old, he started waking me up in the middle of the night and bringing me into the OR to watch cases. And so I got exposed to surgery very early, and I liked it. I remember my first delivery. I was about 12, and I remember it was an Indian colleague of my dad's, and he said to her, "Would you mind if my daughter just came in and stood there?" And I remember just my eyes completely welling up when the baby came out. It was just so overwhelming. And I think that I still feel that way sometimes now, 20 years later. That sometimes in the moment, particularly with a delivery, you can feel overwhelmed, and certainly you feel that way when you're very connected to the patient or very excited for them, or say they've got 3 daughters and they really want a son and out comes a boy, and I always let the dad announce the sex because I feel like that's really fun for him, and it's really fun for the mom to hear it from him. So if I deliver the baby and I tell everybody else in the room to be quiet and let the dad say it, and if he says it, obviously it's a big moment for him, and it's really, it's very emotional too. The best part is the patient relationships. I mean, that's the best part of any day. So, you come to the office and you might have 20 patients booked, and maybe there's 15 that are old patients and 5 that are new patients. And so every day is different, and I meet great people every day. I think at St. Elizabeth's, one of the things that I think is most important here is the level of care. So if we're talking for a laboring patient, you want to make sure that you have an obstetrician in-house, which we always do, anesthesia in-house, which we always do, maternal fetal medicine, 24-hour capability, the NICU is a level 3 nursery. So if that high-risk issue surfaces when you're 9 centimeters dilated and you're about to have your baby, that's not the moment where you get to say, oh, now I want to be at a level 3 facility. You have to have positioned yourself for success and safety.